How can I understand conflicting observational studies? Imagine reading two reports about the same treatment and feeling puzzled because they give different answers. That's common in research, especially with observational studies. Let's explore how to make sense of these mixed messages. First, what are observational studies? They are research projects where scientists watch what happens to people without changing their treatments. Unlike clinical trials where treatments are assigned, observational studies follow people as they naturally receive care. They help us see how treatments work in real life, outside of controlled settings. Now, why do these studies sometimes disagree? One reason is differences in who is included in each study. For example, one study might look at younger patients, while another focuses on older ones. If the groups are different, the results might not match because of those differences, not because the treatment is better or worse. Another factor is confounding variables. These are other things that can influence the results. Say one group of patients is healthier to start with, and that makes the treatment look better. If the study doesn't account for these differences, the results can be misleading. Researchers try to control for this using special statistical methods, but some confounding can still slip through. Data quality also plays a role. Sometimes, information is missing or incomplete. Patients might drop out of the study or forget to report certain details. Different studies handle missing data differently, which can lead to conflicting results. The way data is collected and recorded can also vary, affecting the findings. Inconsistencies happen when studies show different effects. One might suggest a treatment helps, another might say it doesn't. This can be because of differences in study design, populations, or how outcomes are measured. Scientists use statistical tests to see how much these differences matter. When looking at conflicting studies, start by comparing who was studied. Are the patients similar to you? Then, check how the studies were done. Did they use good methods to reduce bias? Did they control for other factors that could influence the results? Studies that use advanced statistical techniques are usually more reliable. Next, see if multiple studies agree. When different research groups find similar results, that's a good sign. Larger studies with more participants tend to give more precise answers. If a small study shows a different result from a big one, the bigger study's findings are usually more trustworthy. Remember, observational studies are helpful but not perfect. They give us clues about how treatments work in real life, but they can also be biased. When you see conflicting results, don't panic. It's normal for science to have some disagreements. Look for patterns across many studies, and consider whether the research included people like you. Always talk to your healthcare provider about what the research means for your health. They can help interpret the findings and guide you toward the best choices for your situation.